Hi, my name is Dr. Trevor Lindgren, and I wanted to give you a Tooth Talk Tuesday topic today to talk about how to prevent cavities. Now, tooth decay is a very common problem that we see. It's the number one reason for people to lose their teeth at an earlier age is due to tooth decay. And also the number one reason for having dental work done in general is having tooth decay. The other problem that we see with teeth is gum disease or periodontitis or other forms of gum disease, but the two main culprits for tooth loss or tooth disease are either dental decay or tooth decay or gum disease. So today I want to talk about how to prevent tooth decay. And tooth decay is also, like I said, the main reason that we have to do fillings or crowns for people. And there's several strategies you can use to prevent tooth decay. There's a small percentage of tooth decay is due to genetics. And because of genetics, you can't really change your genetics. You can't change who your parents are, but that's a small percentage of why people get cavities. That maybe makes up about 30% of the reason why you might get cavities. So even if you don't have great genetics, even if you weren't born with the greatest teeth in the world, in most cases you can do a lot with taking care of your oral health in a way that will prevent cavities. I watched an interesting video by a doctor named Michael Greger, who made a video talking about how if you didn't eat any added sugars in your diet, you would virtually never have cavities. Now, there's added sugars in a lot of foods out there. Almost every food out there has added sugar. So avoiding added sugars entirely is very difficult. It can be done. It's just very difficult, but it's probably healthier for your body and your teeth in general to avoid added sugars in your diet as much as possible. So that's my first tip to avoid tooth decay, is to avoid added sugars. And one interesting thing is that added sugars are in everything. If you think about yogurt or processed foods in general, including sugary breakfast cereals, they did a study found that sugary breakfast cereals are actually worse for your teeth than eating candy. A lot of times the first thing people think of when they think of, oh, I don't want to get cavities, is eating candy because of all the sugar in candy. And yes, candy is bad for your teeth, of course, but there's a lot of sugary substances out there that are worse than candy, one of them being sugary breakfast cereals. For some reason, they've done studies comparing candy consumption with sugary breakfast cereals, and sugary breakfast cereals are just as bad or worse for your teeth than candy. Another sugar source that I see that's a huge problem is sugary beverages like juice and soda. Even sugar-free sodas are very acidic and can damage your teeth and cause cavities. So avoiding things that have added sugars in them, including soda and juice, even natural juices like orange juice or apple juice, are not good for your teeth. They have a lot of sugars. Because I do advocate you eat healthy fruits and vegetables, but I don't recommend you eat the juices of fruit juice. And I do have a fruit smoothie occasionally, but the benefit of that is you still keep the fiber in it. You don't just juice it. And so, and if you're going to consume juice or smoothie or anything that's acidic beverage like that, then I recommend trying a straw. You can use reusable straws, like they make these nice silicone straws that my family likes to use, that you can use so that the fluids you're drinking don't touch your teeth as much and are less likely to cause decay. So reducing sugar in your diet, especially in the form of sugary beverages, sugary breakfast cereals, hidden added sugars in other foods, is very helpful for your whole body. It makes your whole body much healthier to avoid added sugars. You're less likely to get diabetes. Insulin resistance in the cells in your body make you much healthier in your whole body, including your teeth. So sugar is a very addicting substance, and I could do a whole entire Tooth Talk Tuesday about sugar, and I probably will in the future. But just remember that the number one way to avoid cavities is to reduce sugar in your diet, and don't feed your kids sugar. Don't get them addicted to sugar at an early age. Sugar is a very addicting substance. It's just as bad, just as addicting as cocaine. So if you can avoid added sugars as much as possible, you get your palate and your taste buds used to eating a lower sugar diet that is much better for your entire body and your teeth. And I'll get off that sugar tangent now. So first tip is to avoid added sugars. The second tip I have for preventing tooth decay is to brush and floss. Of course, that's what you hear all the time when you go to the dentist. Make sure you brush and floss your teeth. I think using an electric toothbrush is beneficial and well worth the investment in money that it takes. Electric toothbrushes are definitely more effective at removing all the plaque from your teeth. So I'd recommend getting an electric toothbrush and flossing every day. Brush at least twice a day and floss at least once a night before you go to bed. And sometimes if you're still getting cavities, even if you brush twice a day, I recommend brushing a third time a day. Maybe brush morning, after lunch, and at night. Or if you're in school at work, you can brush in the morning, then brush when you get home from school or work, and then brush again before you go to bed. So you're brushing 3 times a day. So for people who don't have great genetics, who are more prone to getting decay, Or if you have a sweet tooth and you're still eating a lot of added sugars, then I highly recommend that you brush more than just twice a day. Brush 3 times a day and floss at least once at night before you go to bed. And for people who hate flossing, who can't get in the habit of flossing, you can try the floss stick, like I made another video about that, or you can also try a water flosser, and that's another option too. So brushing and flossing more frequently gives you an extra added fluoride exposure to your teeth, removes the biofilm plaque from off your teeth more frequently, and makes your teeth and your gums much healthier. So that's why I recommend brushing and flossing. Brush an extra time per day. You can use fluoride mouth rinse, can be helpful if you're not able to brush 3 times a day, but brushing 3 times a day is more effective than brushing twice a day and then using mouth rinse once a day. So before you go out and buy a fluoride mouth rinse, I'd recommend that you just brush 1 extra time per day instead of using the fluoride mouth rinse, because the fluoride toothpaste has more fluoride in it than the mouth rinse anyway, and you're also getting the added benefit of removing the biofilm more than just twice a day. Some of you, it's a struggle to even brush once a day. And for those of you who are just doing that, even just increasing it to 1 more time. If you're just brushing once a day, just do 1 extra time per day, brush twice a day. Just steadily increase that habit, go from once a day to twice a day. And even doing that might make a big difference. And some of you are lucky and you don't take very good care of your teeth and you still don't get cavities. Some people are just really lucky genetically that way, where they tend to not really get cavities, or they have a good diet and so they don't take very good care of their teeth and they don't eat very much sugar, so they don't get cavities. So some people are lucky like that. But if you're not lucky like me, I didn't grow up in a dental family. My dad was a construction worker, so he grew up drinking some juice and having some sugar, and I took pretty good care of my teeth, but I did have cavities as a teenager and in my 20s. But having changed my habits since then and eating less sugar now and brushing more frequently has helped prevent getting cavities as often, even though my genetics aren't perfect for avoiding cavities. So even if you don't have great genetics, you can do things to prevent cavities. So we already talked about reducing sugar, brushing and flossing more thoroughly, and then fluoride. It depends on which community you live in. In Utah County, where I came from, there wasn't any fluoride in the water, so it made people a lot more prone to getting tooth decay. I think here now in Salt Lake County, they do add fluoride to the water. And so that's a little controversial. Some people are afraid of fluoride being added to the water. I don't really want to get into the issues with that. But I think having fluoride in your water is helpful for preventing tooth decay, for sure. I do see a huge difference in people who come from fluoridated communities versus those who come from non-fluoridated communities in terms of how many cavities I see them have in their teeth, especially between their teeth. So that's not really anything you can change very easily anyway, so that's not a big issue. It's almost like genetics. It's you have it or you don't. But if you live in an area where there's not optimal fluoride in the water, then just brushing 1 extra time per day with a fluoridated toothpaste can make a big difference. So brushing and flossing frequently, avoiding added sugars in your diet are huge, and those are the 2 biggest ways to prevent cavities. If you can do those 2 things, you'll avoid most every cavity. You can do other small things. You can suck on sugar-free mints. Some people have really dry mouth or tend to get cavities more frequently. As you start to take medications or start to get older as we age, the amount of saliva that our body produces goes down. And so you can do things to help stimulate saliva flow that helps prevent cavities. You can chew sugar-free gum or suck on sugar-free mints. You can use Biotene mouth rinses if you have dry mouth. So helping prevent dry mouth is also helpful. There's not a lot you can do. There's oftentimes medications that you have to take for certain health conditions that you have to take no matter what. So you can't really change that necessarily. But dry mouth does affect if you get cavities or not, for sure, as well. And I see that more in elderly people where they get decay on the root surfaces of their teeth because they have really dry mouth. So you want to be careful with chewing gum, though. As I've mentioned in other videos, you want to be careful you don't chew gum too often to cause TMJ soreness. But there's lots of things you can do to prevent cavities, and I think it really boils down to avoiding sugar and brushing and flossing more thoroughly. And also, it's a good idea to come and get your teeth checked professionally on a regular basis. Cavities can grow at different rates in different people. I've seen cavities grow really fast in some people who don't have very good oral hygiene. And I've also seen cavities grow really slowly over many years. It takes to grow a small cavity to get larger. So, and if you haven't been in to see the dentist for a long time, I highly recommend you come to see us at Copper Mountain Dental and get your teeth cleaned and take some x-rays to check and make sure you don't have tooth decay between your teeth. Because cavities can grow undetected and between your teeth and not have any symptoms of pain whatsoever for quite a long time. And the cavity can get very large before it even starts to have any kind of symptoms of pain. So you definitely want to check and find cavities when they're small rather than wait until they're large. So I highly recommend you come to see us, get a professional cleaning and exam done, and check and make sure you don't have cavities, because if they're small, we can treat them with simple things like fillings. If they're very tiny and they're not big enough to be treated yet, then even using some fluoride varnishes or increasing the amount of flossing and brushing you're doing, like we mentioned, might help. But if you can come in and treat them when they're small, you can avoid things like crowns and root canals and extractions and implants, and expensive procedures that are more invasive and more expensive can be prevented by taking care of the cavities when they're small. So I highly recommend you come get your teeth cleaned and checked, and we can help you, give you strategies on how to prevent cavities. Thank you so much for watching. My name is Dr. Trevor Lindgren at Copper Mountain Dental. Give us a call, we'll take good care of you. Thank you so much.